This is Dr. Jerry Hesch demonstrating a technique to increase mobility at the AC joint. My client appears to have a rotator cuff tear in the right shoulder, but this video is only focusing on the AC joint, okay? Now, the right clavicle appears to be more inferior, and I can't get spring mobility there, but on the left side, I can get good spring mobility, okay? And the same thing, this lateral clavicle appears more posterior, and I can spring the left side posteriorly. But on this side, I'm trying to get some inferior spring mobility. There is none, okay? I can glide this clavicle medially. You see that little tiny bit of spring mobility, but I'm unable to get any movement laterally along the direction that the clavicle lays in, okay? The acromion, of course, joins clavicle, called the AC joint, and it's superior, okay, as in towards her ear. I can easily spring the left side, but this side I can't spring. So the technique that I use is quite effective in improving the mechanics of that joint. I capture the scapula and her clavicle points out this way, so I parallel that force and I simply take up the slack. The acromion is right there. I take my hand and I glide up the axilla and then I fall down and then I just traction that laterally, okay? I like to do it for about 2 minutes, but for the purpose of this video, I'm going to just hold it for about 30 seconds. I have enough force in there that should work. So what's really nice about this technique is it's very effective. And the literature talks a lot about, significant injuries to the AC joint, but very little talk of mild injuries where there's a loss of micromotion. Typically, these people have very tight pectorals that won't release with soft tissue work, and they'll have some inhibition of the middle trapezius and the rhomboid muscle. I'm not able to demonstrate that because of her pain with movement due to the cuff, all right? So let's see what happens. Now I can load and spring that, okay? And then I'm on top of it. It's more symmetrical, and I can load it and I can spring it posteriorly. And the movement is not excessive, so I don't think there's an instability. You can see I can pull it laterally. It now moves that way, and now I'm going to spring it. My direction of force is lateral regardless of how my hand looks. So, and I can get inferior load and then inferior spring through the acromion, okay? This may or may not help her symptomatically, but it's part of the function of the shoulder, and I submit that she will have a much more successful rehab of the shoulder with this motion restored, because the AC joint, of course, moves with shoulder motions. But I'm going to change the camera angle. And then I'll have you sit up and move your shoulder around and give us feedback, okay?
Okay.
So it'll be a bonus if it feels helpful.
It feels a little better.
A little better? I'll take it.
A little looser.
I will take that. So thank you so much. I really appreciate this.
Sure.